This is Reverend Dr. Michael Vanderpool, July 15th, 2011. And in talking about some astrology and intuitive consulting, I recently had done with a friend who, for many years now, has gotten astrological and intuitive consulting from me. And recently, I had noticed in talking with one of his loved ones and taking keen observation myself and going back and remembering different things. As a former nursing care administrative assistant, actually operated a residential care facility, and working under the laws of the state of Missouri with, under Division of Aging, Department of Mental Health, some very strict rules in some cases in managing health care and dealing with, the medical professionals and managing care for all the people in the nursing home and staff. I'd seen a lot of things, quite a few things. Dealing with psychologists and psychiatrists and social workers and medical doctors, surgeons, and a number of different health and medical specialists, nurses, of course, and all the aspects of providing health care in the American healthcare system. And in any case, we often also had to provide that, or manage that care for people with diabetes, which is, from what I've read here, even recently, on the rise in the U.S. It's quite prolific and quite a serious problem. So, in any case, I had felt that he might have this. He might have, in looking at some of the things, the behaviors of someone that has diabetes. And I'm not a doctor, a medical doctor. I'm not a medical doctor. I'm not a person that diagnoses, cures, treats, or doses anybody or anything, especially disease. So he went to his local medical doctor, and that local medical doctor wrote him a physician's order to go take a test to determine if he's got diabetes, and typically those tests are 3 hours. Well, he's familiar with Dr. Sherry Rogers' books, and those books are at Prestige Publishing, the website prestigepublishing.com. And she's a licensed medical doctor in the U.S. I think she's working with a hospital or clinic there in New York at this time, Environmental and Chemical Sensitivity Center, if memory serves me correctly, something like that. But in any case, she's suggested in her work that any tests for diabetes that are under 6 hours are not always catching those cases where there is diabetes present. Now, again, I'm not a medical doctor. I don't know. And but my friend knows about it because he read her work, and it's even posted and discussed on some forums on the internet. And so he went he went out of town and got the test done, and in the 4th hour of the test, it was so bad, a great sweat broke out, and he almost went down. And the doctor overseeing that test there called his local medical doctor back in his hometown and said, hey, it's just not good. And so the local medical doctor said, hey, cancel the test. And unbelievable, my friend thought, unbelievable that he had actually ordered to cancel the test. And I was like, well, why do you think that he did that? And he says, well, because he's probably, found out that he's wrong. He's wrong, and all these years I had brought this up to him and said, look, I'm concerned about having low blood sugar. I got all these symptoms of type 2 diabetes. I've been, whenever it's time to eat and I'm unable to eat in a reasonable amount of time, I have all these problems. I have all these things going on, and this is why. And so he thought, well, it's just because he's gonna find out he's wrong. He's been wrong all these years. That medical doctor is wrong. Well, I said, so that's why you think that he called and actually ordered the doctor overseeing the test to cancel the test? And he goes, yes. And the ironic thing is that this doctor went ahead with the test and completed it. It was a 5-hour test, and he himself had diabetes. Then he was really concerned that this other medical doctor called and ordered the test to be canceled in the 4th hour. And the other important thing to note is that my friend, was actually told by this doctor that oversaw the test, that actually gave the test, that it was one of the worst cases of diabetes. He mentioned the numbers, and again, I'm not a medical doctor, and the numbers were so extreme that they couldn't understand how he was even getting along as well as he's getting along. I mean, they're really wondering how he's even really functioning. It was very bad. It was a rather extreme case of a test result showing diabetes. And so intuition can be ever so important in your life. I had, as many of you know who follow me on the Facebook, been reading Psychic Intelligence by Terry and Linda Jameson, Psychic Twins. And there's some excellent information in there, and they discuss how that intuition can be incredibly important, especially in life or death situations. And here I have my friend telling me that he thought for some years that this was his problem, and then the medical doctors that he has said, did some small test, and no, that wasn't it. And then I noticed, as a former administrative assistant of nursing care for 5 years, as someone who actually ran a residential care facility, as someone who, as a family, I've got a family that's been involved in that business for well over 30 years. I don't count anymore all the time, obviously, but I've got a mother that still runs a nursing home, and she's, it's a residential care facility, and she's, we're always talking, about different things and about issues of health and how, how she's managing, the care there and what's going on in the medical community sometimes. And this is just an ongoing thing. It's a part of our family. It's a part of what we have done for many years. And I had felt so strongly about my friend getting to his medical doctor and finding out about this, because sometimes he would type something into Skype or an email, and it wouldn't really make sense. It's almost like talking to a drunk. Words would start to slur or come out wrong. It's a terrible thing. And I'd known the guy well enough and good enough and long enough to know that, there's a problem. And a lot of people are fearful when they go to a doctor. They're fearful to get certain tests. And it's a fear that is better faced and dealt with than ignored. Than to look away from. Because, again and again and again, we had heard and we're told that early detection is a key in some situations for the best options, for the best chances of a greater possibility of greater success or treatment of a disease. And again, I'm not a medical doctor. I'm not here to diagnose, cure, treat, dose anybody or anything. And I had saw that he was delaying, whether it was intentional or not, or circumstantial or not. I saw that he was delaying getting this done, and things are getting pretty bad for him. And what was obviously a person with severe diabetes. And I even refused to speak to this person for many days, knowing and feeling that if I'm speaking to someone that has something so severe that they're not even able to think clearly, sometimes in some of those discussions, in some of that speaking, then what's the point? Until they get to a place where they're taking care of themselves and they're taking care of what their medical doctor told them that they need to go and take care of in terms of a test. Then what's the point? Intuition. How many times I've heard people speak about intuition when it comes to matters of health. And the first time I really clearly remember this strongly, listening to Dr. Richard Schultz. I myself have some of the greatest health challenges over the last decade or more. And in the early days of that, even before that actually, because I had a loved one who had some pretty interesting and challenging health problems that she overcame, and so was inspired and motivated at that time especially to listen to a lot of what Dr. Richard Schultz had to say. And that was one of the great points I'll never forget, is how important intuition can be when it comes to your own health. Don't forget the power of the divine that is within. Don't forget your own gut feeling. Don't forget that listening to yourself sometimes is incredibly insightful. Power of your own intuition. And, I won't go into the whole medical system, the whole issue about the books, for example, that are out there by great doctors like Dr. Sherry Rogers, medical doctor, at prestigepublishing.com. And the incredible amount of little known, but extremely important information that's in her books. Unbelievable. That my friend goes and gets this test, 5-hour test. But I actually think that he convinced that doctor that actually gave the test to look into Dr. Sherry Rogers' work, and they're actually considering extending that test to 6 hours. I don't know. I'm not a medical doctor. But I do know that my friend, for years, states he went to his local medical doctor, and they did, the normal, standard, orthodox tests for this problem that he has now officially been tested for and found to have in the extreme. Amazing. True story. An important story. So to wrap this up, I love astrology, and sometimes without it, it's hard to know the cosmic weather and looking ahead. And sometimes with it, and the power of intuition or intuitive insight, we can even predict the future conditions down to the day, certainly down to the week. And hope and apply our will and hopefully a measure of wisdom to try to change that if it's not a favorable outcome in the intuitive sense. For a better outcome, or manage things in such a way that we can get the best out of the situation, so that we can really minimize the more heavier blows of fate, if you will, or at best change our destiny or destined path for the better. If and when that's possible, as philosophers throughout the ages have argued about rather extensively. In any case, that's it from me for now. Unbelievable. I really love the work of Dr. Sherry Rogers, medical doctor, and her books at prestigepublishing.com. Because without that, I'm not even sure if I would have some elements of my current state of health where they need to be. Some. So that's it for now. I focused on those things in this audio, and I'm very grateful that my friend was able to get that test done. Of course, it would have been better for him to have gotten it understood or learned about or tested for perhaps a long time ago previous. I don't know. I'm not a medical doctor. But I think he knew His intuition was telling him. But his medical doctor, his local medical doctor, apparently didn't know. And the test that he provided, in hearing his story, my friend's story, one would assume, well, in any case, I'll leave that as it is. Thanks for listening. Don't forget to subscribe to my channel